Women's Care Florida is trying to be at the forefront of decreasing the opioid crisis. And Dr. Stephen Greenberg is here to discuss options to help decrease the use of opioids. Welcome back to the show. How are you?
I appreciate it.
So the opioid crisis, I feel like, you know, it's just words to some people, but if you've experienced it in your family, it takes on a whole new meaning. The impact is devastating, but to hear about what you're able to do for women, it could hopefully battle it a little bit, right?
Well, we hope so. It is a terrible process going on right now in Florida. It's been a devastating problem for a lot of young people, and even as they get older. And so what's been going on in the OR world completely, and it didn't start in OBGYN, but there's a program that most hospitals try now called ERAS, Enhanced Recovery After Surgery, and part of that is decreasing the opioid use. Now we know major surgeries, you're going to have pain, so we have other options and other medications that aren't addictive to put you on during the surgery and after the surgery to help decrease that pain management. So opioids I've cut my opioid use down by at least 70% in my post-operative patients now.
Because you were saying the majority of people who do get hooked on opioids, it's after a surgery,
At least 50% of opioid addicts start in a post-operative or a post-injury time period. So if we can decrease how much opioids and how long people are taking them after surgery, it will decrease the amount of people that end up addicted to those opioids.
And what kind of caught me by surprise is when I think of opioids and I think of post-surgery, I think of orthopedics,
right.
I think of injuries, but women's care, you've got just as many surgeries that are happening.
We do, and it did start in orthopedics, and we sort of transitioned it over to women's health at this point. Majority of it is for GYN surgeries, hysterectomies, and different types of surgeries. Now we do a lot of what we call minimally invasive surgeries, so that's already reduced the pain quite a bit. But again, we can even cut that back even more by using these other medications. There's 2 or 3 medicines we use starting preoperatively all the way through the postoperative time period. We use an injection sometimes in the incisions, sort of like Novocaine or lidocaine that you get at the dentist office. We've always used that, but typically the one we've used lasted about 3 hours. Now the newer one lasts about 3 days. So that alone can help decrease pain management requirements for sure.
Getting over that 2-day hump that always
really is.
Hear that second
Most of the time it is. And we're starting to, we do still do some different pain management things in our postpartum patients, our delivery patients, C-sections especially. A little harder, we can't use some of the meds if they're breastfeeding, but majority of them we still can use quite a bit, and it's a matter of how you do them, not just using them. There's a certain specific way of using them that really makes it work a lot better.
Because I was sharing with you, I've had a C-section, and I kind of forget that was a major surgery, and
Absolutely.
So I'm assuming you get a lot of women who have had the C-section and are like, wait a second, I don't want this kind of pain management,
right.
And that's where you can help.
Absolutely, and as I mentioned too, I'm sort of on the lucky side. I don't have to take care of men. Women are really in general much tougher than men. They need a little less.
Knew I like this doctor, right?
They certainly need a lot less pain management in general, but by the same token, we don't want them to be in pain either. That's a big push in the last 15-20 years from all of medicine, is to make sure patients aren't in pain. And so that's how the opioid crisis started, of course. The drug companies seized upon that and started throwing out these narcotics. Oh, well, you don't want them in pain, so give them these drugs.
Yep.
And there's so many other complications and long-term bad outcomes that we want to try to go back in the other direction and reduce the amount of opioids that we use.
Well, I think the response has probably been really positive since you've been able to do that. What reactions are you receiving?
Oh, it's
from patients
unbelievably
and
dramatic. Yeah, absolutely, unbelievably dramatic. And one of the things that makes me feel the best is when I go down to the floor and see my post-operative patients, my hysterectomy patients, let's say. I do it a little bit differently than some of the other doctors, but the post-op nurses love my patients because they're so much easier to take care of, so much less requirements, and they're so happy that they can get them out of there a little quicker too. So it works out really well, and again, the nurses giving me that positive feedback helps me feel even better about things.
You know, of course, patients are the first and forefront of your mind, but one thing that I've learned about Women's Care Florida, you also have a foundation that you use to be able to help the community, which I think just speaks volumes.
Oh, thanks for asking. It's been around for about 3 or 4 years now, and our foundation tries to help smaller women's directed foundations. We donate money. We just gave away approximately $60,000 to about 15 or 20 different foundations in the last few weeks. And again, we try to keep it smaller, but these smaller foundations in the city need a few $2,000 to $3,000 a year. Really supports them quite a bit. If I give $2,000 to to the American Cancer Society, that's a spit in the ocean and they really don't care. So these other foundations, it's a huge portion of their budget.
Well, you know what? I know we can spend more time talking
Yes,
about
let's
that.
do
So
that.
hopefully we can do that.
I would love to have a segment on that. Perfect.
Okay, that's a deal. And in the meantime, we're so glad that you're joining us. We're going to have regular segments now with Women's Care Florida. We're so happy that they're part of the Tampa Bay's Morning Blend team. If you want more information on how Women's Care Florida can help you, just visit their website at the address that you do see on your screen. Dr. Greenberg, we really appreciate your time.
Thank you very much. Appreciate it.